Thank you so much. This is really the fun part of the program because the end is in sight. It's been a lot of work, and I get to thank people, and that's always gratifying. I think we can all agree that we have a deeper understanding of why palliative care matters. I want to start with an expression of gratitude from Carleen and myself to Karen McMillan and the Covenant Health Senior Leadership Team. 1 year ago, they had the fortitude and vision to ask the Covenant Health Palliative Institute to promote palliative care on a national scale. We're honored and privileged to wake up each morning and come to work, and it's been a busy year. Thank you, Karen McMillan. This led to a modest proposal written November 23 last year, which marked the beginning of a wild and wonderful journey. Fred Horn, our wise and humble mentor, stood by our side every step of the way. And I have to say, where we are today is in large part a result of his wisdom and guidance. Thank you, Fred. Show of hands, how many people at the end of a movie leave before the credits? So actually, many people leave before the credits. And you know, the credits acknowledge all of the people that have worked. And as you've noticed over the years, those credits get longer and longer. And it was the same, I had the same problem. I wanted to read and acknowledge each and every person that contributed. But I think Fred would be upset with me because I would take over the entire morning. So I beg your forgiveness, and will acknowledge individuals when I can, and groups otherwise. And we can applause at the end of each acknowledgement, or we can save to the end. I don't know that I can contain my applause to the end, and I ask you to use the same judgment, much as the symphony, knowing when to clap between the acts and so forth. Public engagement is an emerging science, and everyone worked hard to ensure that the patient, the family, and the public voice were heard. If you want to fix the healthcare system, ask the patient, ask the family, ask the public. They are the true experts in their own care. Honoring those who meaningfully answered our call acknowledges a promise to do all that we can to influence policy and practice. We are committed to an actionable report. Embedding public experts in all of our committees, including them in the development of our protocols and enhancing their role in the consensus process, were critical to the success that we witnessed this morning and throughout the conference. Patients are experts, family members are experts, public are experts. I learned from all of you, and we are all better for your input into the questions, the methods, the deliberation, and of course the recommendations. Your grace, wisdom, compassion, and most of all your knowledge of what needs fixing. Your thoughtful questions, patience, and boundless energy. Room 520, for those of you who don't know, was ground zero, where science and public mingled and magic happened. We promise to work hard and honor the commitment you made and make sure that your recommendations do not gather dust on a shelf. Don Newman, one of Canada's most respected journalists, need I say more? I encourage everyone to stand and thank Don and our lay panel, because they were the ones who made all of this happen. As Fred described earlier, a consensus development conference is a stylized method to create an interface between science and the public. In terms of science, I owe an especially deep debt of gratitude to the scientific panel. Sean Morrison's acceptance came in seconds. I had to call him and was right. I asked if he had read the email, and he hadn't read the email. His acceptance exemplified the best of academic collegiality. To be clear, I asked the scientific experts at the beginning of July. They gave up some of their summer. They gave up time with their families. And they put in a lot of work. We played dodgeball. Each member dealt with a barrage of hundreds of papers. Their gift of knowledge and time on such short notice is a debt that I cannot repay. Thank all of you. There are so many to thank. There are so many moving pieces. There were many palliative care matters committees. The technical committee that provided operational oversight. The Canadian Reference Working Group, many of you in this room participated in that process, consisting of stakeholder and public representation and coming up with the questions. The Covenant Health Palliative Institute research team, who tirelessly identified and assembled evidence supporting the expert panel. And I know they're on their monitors this morning, and you know who you are, thank you. The Communications Committee, not only media and social media, but really the glue which kept our stakeholder organizations informed and working together in harmony. The Evaluation Committee, acknowledging the guidance and support from the Canadian Foundation for Healthcare Improvement and the Alberta SPORE Support Unit. These committees, and indeed all of our work, were supported by a broader infrastructure provided by Covenant Health. In addition to the senior leadership team, legal, finance, project management, communications, and library services. Many names in each of those departments. It took a lot of hands. Our Phase 1 work required the expertise from Ipsos, from Erin Rolston and her staff. Thank you, Erin, for your work on our survey and your patience with me. The conference would not have taken place without the talents and knowledge brought by Jewel Buxa and her Palliative Care Matters program management team. This was a well-organized event. Every attention to detail came out brilliantly. Thank you, Jewel. We didn't work alone. There were many hands that helped at this event. The webcast and the videographers, the AV technicians from Freeman, the tireless interpreters, and the Marriott staff for their hospitality. We slept well, we ate well, we sounded great in both French and English. And we looked good on camera. Thank you. Jim Mulcahy's story touched us all. His courage and dignity serve as an example. I also thank in advance T. Din and Carol Stonebridge from the Conference Board of Canada and for the work that they're about to undertake these next few months in Phase 3 of the final report. Lastly, but certainly not least, you, the audience, both in person and online. Our last count was close to 400 sites. You are the public. This is for you. Thank you for taking time from your busy lives and joining us in making history. Thank you. Public participation requires that we communicate how this impacts future decisions. I want to assure you that the Covenant Health Palliative Institute are working as we speak on the next phase to sustain our efforts and evaluate the effectiveness of this endeavor. We will continue to work with all of you to apply the best scientific principles and to temper our work in full partnership with all Canadians and with each other. And thank you very much.